Six Sigma in healthcare. The scope of Six Sigma in healthcare is very much. Healthcare is not just doctors and hospitals, it is inclusion of the entire complex industry systems. And there is a overlap zone where medical devices co-span both manufacturing and the healthcare systems. Therefore, HR and IT must manage both the spheres. As shown in this figure, apart from that, there are some core sectors. So we have providers, support services, equipment manufacturers and distributors, and the insurance companies. So providers include from small local practice to large-scale hospitals and multi-building hospital campuses. Support services included the clinical and non-clinical assistance networks, equipment manufacturer and distributor where medical devices and consumables are managed with the help of Six Sigma. Insurance companies where payers and health plan administrators manage the Six insurance companies with the help of Six Sigma. So Six Sigma expert is mandate. You have to understand that how methodologies integrate into all the clinical operations, state and federal compliance frameworks and auxiliary workflow like claim billing. Basically, Six Sigma eliminate the waste and improve the workflow with the help of DMAIC, define, measure, analyze, improve, and control methodologies. So, what are the benefits of Six Sigma in healthcare? According to American Hospital Association, average hospital operating margins between 1993 to 2015 is merely 2% to 7%, as shown in this figure, and average hospital total margin in the same year is 4% to 8% increase. So there is very margin room. The margin is very thin, so cost cutting must not compromise the patient care or the regulatory compliance, because thin profit margins demand the lean processes, that is reducing waste and optimizing the workflow. But this does not mean we have to compromise the patient care or the regulatory compliance. As noted in the multi-customer dilemma, as noted in one of the hospital study, that is Becker Hospital Review 2015, healthcare organization compete on both quality of care and cost of service, but they are not just serving patients. They must coordinate with the end users, that is patients, referrals, partnerships, accreditations, or the insurers or the payers. So the paradox is faster for the patient might mean more expensive, and lower cost might break the compliance. So the DMAIC methodology resolved this, that is a Six Sigma methodology resolved this by balancing and optimizing outcomes across all the customers simultaneously. Now, there are areas of the clinical and administrative improvements like the clinical operations, which saves the lives. So, what they do, they prevent clinical errors leading to extended treatment, and they minimize the healthcare associated illnesses and injuries. They also reduces overall rates of mortality or the avoidable death, and they also protect the organizational brand and lower the malpractice lawsuit exposure. So Six Sigma saves the lives in a clinical operations. In admin and auxiliary operations, the correct errors in enrollment and claim billing to stop the payment delay, streamlining the inventory ordering to avoid the critical supply shortage, cuts down physician error rates, shorten patient wait times and lab turnaround cycles, and decrease the supply chain steps and the operational frictions. Now, what are the challenges in healthcare Six Sigma implementation? Number one challenge is the constant of the compliance regulations, that is clinical requirements, following the HIPAA protocols, state or federal rules, insurer terms. All these dictate strict operational barriers. So we have to follow some rules. Rule number one: never try to work around or bypass the compliance parameter. Rule number two: regulatory compliance is automatically treated as critical to quality characteristics because they are very critical to quality. And number three, the mute challenge, that is a waste challenge. Regulations often force duplication, overproduction, or heavy reviews. Therefore, Six Sigma team must accept this unavoidable muda or the waste challenge and optimize the non-regulated surrounding area. Number two challenge is the unnecessary compliance muda, that is waste challenge, where organizations often conflate the historical outdated habits with strict laws. So we have to do it that way because of the law, regulation, or the accrediting agency. The fix is that Six Sigma team must work hand in hand with compliance to evaluate where true regulatory mandates end and where waste can be safely eliminated. So the directly compliance with the regulatory bodies prevent the wastage. Number three challenge is the statistical challenge, where the confidence levels or the alpha levels and the risk settings are managed. Six Sigma expert must manage the analytical precisions of confidence level. Confidence level is the alpha level to the real world severity of the process outcome being analyzed. So we have two type of processes: administrative process and direct patient welfare. Administrative processes include the claim billing, and direct patient welfare include the surgical procedures. Administrative processes or the functions, the confidence level is 95%, where the alpha is equal to 0.05. This means the standard statistical threshold acceptable for billing and administrative flows, where errors do not directly cause the physical harm. And direct patient welfare, the confidence level is 99%, or the value of alpha is 0.01, which is highly critical setting. It minimizes the type 1 error risks in clinical trials or the high risk procedures. So the cost of precision versus the sample size, this is the common example pitfall, means increasing the confidence level from 95% to 99% demands significant larger sample sizes or a greater number of runs in the design experiment, and this spikes data collection cost. Expert must weigh the cost versus accuracy before executing the statistical plans. So this is all about Six Sigma, where we balance the DMAIC model or the methodology to optimize the healthcare services and provide the quality patient care, therefore no compromise on the life or the law.